Hello, my YouTube subscribers. Welcome. I am Dr. Tammy, and I have been doing a series on anxiety and managing your anxiety. I think we have now done 4 episodes about anxiety and how to manage it. I strongly encourage you to go back and watch the first one and go through them in sequence because I lay a very important foundation in the very first video about the neurological system and the autonomic nervous system and how that is affected when we get anxious. It has everything to do with how you experience anxiety in your body and the effect that that has on your life. It also is so critical to understand that as you are working toward managing and eventually completely overcoming the anxiety that so often cripples us from doing the daily things that we need to do and going beyond that, reaching goals that we would like to reach, but possibly the anxiety is so overwhelming that we can't do that. So please go back and watch those. So, like I said, my name is Dr. Tammy, and I'm a clinical psychologist and I am a licensed marriage and family therapist. I have been working in the field for many, many years. I have also worked as an adjunct professor at a university in the Department of Behavioral Sciences, teaching and preparing students who will eventually become therapists. I enjoyed that greatly, being able to pour into students who will be able to work with folks across the board. So, but what I do need to say, as you have heard me say before, that I'm doing this video and it is not therapy. I'm not providing you therapy. I am only providing information for you to help you. So it's strictly information, teaching you some different skills. But if you are struggling, especially if you are having thoughts of wanting to harm yourself, you need to seek professional help or call 911 and get yourself help. There are a lot of excellent therapists out there. And even if you have had a poor experience, because I know people have had poor experiences with therapists, and unfortunately, there are therapists out there and psychologists who are not that great and really honestly shouldn't be in the field. But if you have had that type of experience, please don't give up because there are wonderful, fantastic therapists out there who would love to work with you. I know that financially it's difficult. So the options to obtain mental health can become challenging. And that's why I'm actually doing these videos and just trying to help with some education because I understand folks today are really struggling financially. Job losses and increase in living, cost of living. Uh, a lot of people don't have private health insurance. I do know that state health insurance does not pay for a lot of psychiatric services. They do pay for inpatient hospitalization. So, psychiatric inpatient hospitalization is paid for usually by a state insurance, Medi-Cal, IEHP. Now, there are some therapists, psychologists, and psychiatrists who do accept IEHP, but that's grown to be a very slim margin anymore because unfortunately, the state insurances do not reimburse providers like myself. So that's very unfortunate. But there is always the option of paying cash. So don't discount that. I know that there are a lot of people who will not seek out therapy because they do not have the insurance and therefore they think they can't afford it. But the truth of the matter is, there are many psychologists and therapists like myself who will do a sliding scale, group practices. I know there are group practices that will also accept patients on a sliding scale. So please don't discount it entirely if you do not have insurance or feel like you don't have the monies. Like I said, call around. I know that there is sliding scale, and I also know that you can choose to do a biweekly appointment or even a monthly, something that can just get you going. So that's just a little side note, okay? Because I really want you to get the help you need. So, the title of this video, I know we had a very long introduction, but the title of this video is called Anxiety and Depression, Chicken or the Egg. Why I'm calling it that, why I called it that is because of this. And this is just to help you understand there is often a relationship between anxiety and depression. And we in the field, clinicians and physicians, and those of us who work with patients who have anxiety and depressions, we say that we're not quite sure always if it was the anxiety or the depression, which came first. You know, that old saying of what came first, the chicken or the egg. Um, I think it was the chicken because when God created the animals, he clearly created chickens. So anyway, that's just my my thought. But in truth, there is that question whether anxiety or depression, which came first. And this is why. It is more common to have a co-occurring the co-occurring disorders of anxiety and depression. Generally speaking, we don't see just anxiety or just depression. Usually we see them together. And some, like myself, feel strongly that anxiety may have preceded depression in your case or in people's, whoever is struggling out there. It is quite possible that anxiety was present before depression. And it is also quite possible and quite likely that anxiety was present in your life. If you are struggling, if you have anxiety today, that anxiety has been there for many years, dating back to when you were in your childhood. Kids, small kids and children they don't understand. They don't have the terminology and the words for what they're going through when it comes to behavioral health issues, mental health issues. They just know their tummy hurts or their head hurts or they don't feel good or they just don't want to go do anything. Our little people will report those types of symptoms when they're experiencing anxiety and or depression. Anxiety is a funny thing. It's it's a serious thing, and it definitely is can wreak havoc on our lives when we are trying to do life. But it's kind of a funny thing in that it just kind of grows. It may start as a small, just nervousness. Might feel a little nervous about something, a little anxious about something, and then we avoid that thing, and then it just can kind of grow, and then it just can take on this life of its own. The other interesting, funny thing about anxiety is that it can be a biological disorder. So, in other words, genetic, something we're born with, something that we have in our family DNA. The truth is that just as we have medical disorders, heart disease, cancer, diabetes, that run in families, they're genetic, so are mental health diagnoses. So we see depression, we see anxiety disorders, we see bipolar disorders, we see thought disorders, schizophrenia, all these different disorders we see genetically run in families. So if you were to sit down and do like a family tree or something, we call in the field a genogram, which is sort of like a family tree, but you're really identifying. So the branches out there with grandparents or great grandparents and your parents and aunts, uncles, cousins down, trickling down, you will be able to trace and see that there were different, maybe anxiety with aunt so and so, maybe depression with this grandmother. We also can trace substance abuse and addiction. So, again, maybe grandpa or uncle Henry over here used alcohol, or, he was known as the drunk or this or that. Now, a couple generations ago, definitely in our grandparents' time, if you're my age and or your grandparents or great grandparents, they did not really not just acknowledge some of the mental health and diagnoses we have today, but didn't have the knowledge, didn't have we didn't have the research and so much what we have today. And also, there was a very strong stigma, especially in different families or different cultures. That is true still today, but not quite as much as a couple generations ago. So, the reason I say this is you may have heard stories handed down in your family. Oh, grandma so and so was just crazy, or aunt, so and so was just always out of it, or okay. So these may very well have been diagnostically categorized as mental health disorders. So coming back around to the genetic predisposition to something, a mental health diagnosis, that is true of anxiety and depression. Okay, so but what is also true is that circumstantial life circumstances can also create the presence and the diagnosis of anxiety in our lives. Trauma, absolutely. When we experience a traumatic event, that can lead to an acute stress disorder, which usually is just within those first 30 days after a traumatic event, and we're having these symptoms. But if they go away after that, then we know that that was just an acute stress disorder. But we also know that if that continues on past that 30 days and we have these very troubling symptoms where we're re experiencing it, where we're just hyper vigilant, where we're, you know, having difficulty sleeping, on and on. We now are looking at some post traumatic stress disorder, PTSD. Um, and if not in this extreme, we may just have that anxiety where our symptomatic, our symptomatic nervous system, our autonomic nervous system, the sympathetic part of that, not the parasympathetic, but the sympathetic, is activated and becomes quite upset. So you can either be born with that predisposition to anxiety or life circumstances. And I know that I have walked through things. I have had traumatic events in my life that have definitely led to increased anxiety. And so I've had to manage those. Now, let's go back to what I first said a moment ago about the chicken or the egg. Okay, so why is this so important when we talk about which came first? Well, in truth, it really isn't quite that important that we identify which came first. But what is important is that we identify that the two are existing, so that there is a a co-occurrence here. There's we have the coexistence of two different disorders that really need our attention and really need treatment, and at the very least for us to begin to understand and educate ourselves about these two separate diagnoses: anxiety and depression. Now, anxiety, and this is why I believe, and many clinicians believe, that anxiety usually showed up first, is because when we are feeling anxious, and if we have not been able to get control of it and learn the skills to get control of it, then we can feel a sense of just helplessness, and which turns into and can become hopelessness and despair, which really becomes depression. A person who is filled with hopelessness and despair is depressed. Okay. And yes, we have a list of criterion that meets, the diagnostic, standard for depression. But in a nutshell, if you are walking around hopeless and having despair, not being able to have any enjoyment or very little enjoyment, um, you feel negative about, you can't have any positive feeling about yourself, about your future, about the world at large, you are experiencing depression. And oftentimes anxiety going untreated, and when I say anxiety, let's think of the umbrella of anxiety here. Generalized anxiety, like I mentioned in our last session, there's that what we call GAD, a general anxiety disorder. So that's just overall wherever you are, or social anxiety, and that's more being out in social settings and not necessarily having those symptoms when you're by yourself at home. Um, but we have our other types of anxieties as well. So we can have and get specific anxieties about certain things. And these can definitely affect and cause such stress and duress in our lives. And we can go to a place and a feeling of, I have no control over this, and feeling so discouraged that can lead to depression. And this is why, we often, see the two together, but also that uh, likely the anxiety was there, and then depression has come in as well. So just understand that the most important thing to understand here is that depression and anxiety often coexist, and it's very important to be able to manage and learn about both of them and be able to get help for both of them. Now, as we've said in our past 4 sessions that we've done on anxiety, and again, if you've not watched those, please go back and watch the first 4 videos that I have done on anxiety, and learn about that. And then you can move on to learning a little bit more and going on into therapy if you feel like those skills that I've taught you are just not enough. Oftentimes I say it's great if you have a coach, you have someone you can work with and who can walk alongside you and really be a sense of support for you as well. Okay, so that's all I have for you right now. Just understanding anxiety and depression, how they coexist, and how anxiety is likely there before depression, and to understand that there really are two different causes, or you know um, sources of our anxiety and depression, and that originate from either our genetic predisposition, so in our family, or situationally in our lives. Okay, so just understand that. And in our next video, I'm going to start discussing about more about depression and understanding depression. So we will do a series on depression and breaking that down and helping you understand the diagnosis depression, what that means, what you can do for yourself, and how you can get help for that. Okay. So please subscribe if you like these videos. If you like learning about this and you want more, please subscribe, please share it. And I just want this information to be available for whoever needs it and wants it. Okay. Love you all. God bless you. And thank you so much. And I will see you in our next video. Okay. And one last thought here about I want you to, as you are listening to these videos and you are following along, I encourage you to take notes, but I also encourage you to go to God's word and see where so much of this, where God helps us in his word to understand, how worry and how anxiety can affect us. And, seriously, here we have our field of psychology and all the research that's been done and great stuff. I love my field, but God in his word has said so many things to help us with our mental health, our well-being, that I feel like those of us in the field have really taken a lot from what God has said in his word, and we've kind of taken credit for it because in the passage where Jesus is saying, don't worry about tomorrow because today has enough cares of its own. That one passage there that Jesus is talking about is about focusing on right now, right here, and not looking outside, out there, and worrying about that stuff. That's part of what we train you to do and help you to do in psychology. In this field is helping you to stay focused in the here and now, and like I said, in those trainings we did in the grounding and the resourcing, that's about being present and being right here and learning how to train your body and not being over there in that thing that's making you anxious. That's the very thing that God is talking about. That's the very thing he's talking about when he says, don't worry about tomorrow. Focus on right here, right now, today. Okay. All right. Now I'm finished. Bye, y'all. I'll see you next time.